Luca and take questions from him. And then if there are any general questions for both of them.
I feel that everything is under control, yeah?
Yes.
I'm glad you do.
Yeah, perfect. I will stay in my car. Are on live in YouTube, yeah? Oui.
Yes, yes, it's live.
Yes, we are live in YouTube.
Tu peux voir sur le site, je pense que j'ai mis à jour s'il y a YouTube qui affiche.
We have 2 times, Mr. Gilimoni. Squeeze.
C'est la rediff sur YouTube.
Hello, Jessica.
Non.
Yeah, appreciate your nickname, yeah?
Yes.
Yes.
Yes, we are here. Hop. Plus d'informations. Il n'y a pas YouTube.
Tu l'as mis là, mais pas sur le...
Tu
sur l'accueil.
Tu rafraîchis la page. C'est bon?
Lui, il est dans la page.
Ah, d'accord, ok. Je me mets à l'accueil, là, à l'accueil. Okay.
Sharon, I have nothing to say, yeah? It's okay, you will manage everything, okay for you?
Il faut qu'on l'enlève, ça.
I can give the welcome to EAHM.
Yeah, as you like, because since I'm on the road, maybe some of the network, the internet is not so good.
Okay.
Disconnected. I just want to say hello to everyone, and other ways you have managed to say it's okay for you. Ah, Philippe with us.
Hello, everybody.
Philippe, you're cutting it fine.
Just on time.
It was a goal.
No comment. No comment.
Do you receive my my document?
Yes, we have your document.
Okay, thanks.
Will you present yourself, or do you need us to share the screen?
I have a slide of presentation, but very small.
Yeah, but
I think it's better that we share the screen.
It is up to you.
I think it's better if you share them, then you can change when you want the slide.
Okay.
If it doesn't work, we can share them.
Till now, there is a problem with your. What are you doing?
I don't know.
Return.
Tu cliques sur vidéo, paramètres vidéo.
Okay.
Move your screen. Hard bar. Comment vas-tu, Philippe?
Très bien.
T'as l'air fatigué là.
Un peu, je suis encore jet-lagué, mais
tu reviens d'où?
De Corée du Sud, de Séoul.
Wow.
Donc c'était très bien, mais c'était un peu, oui.
T'es rentré de quand?
Hier.
Wow.
Hier soir.
Mais ce jet lag vers l'ouest, moi j'ai toujours géré, c'est vers l'est, c'est compliqué.
Non, ouais.
dors pas ce soir, va en discothèque. Pendant la journée. Je sais que tu fais pas ça, je sais. Travaille plus alors. What we do, well, the time exactly was 8 p.m. Yeah, 6 p.m. Yeah.
Yes.
Will we start?
Yeah, I think we can go ahead. If you
Okay.
agree, please.
I don't think Mark Aster is here.
Mark is not with us. Yeah, sure.
We spoke together this afternoon. Yeah, he told me he would be here.
Maybe we have to wait for some minutes, I think.
I promised last time to be on time. You are pushing me to be late.
Oh, we have Mr. Bumke here with us. He was the speaker from our last webinar.
Hello.
Hello, Paul.
Hello, nice meeting you.
Hi.
Hi, Paul.
Hi.
We can say that we can start in 2 minutes. Okay, we do so. Even
Okay.
without Mark. Just saying a couple of words just to say welcome, and then you will manage the shadow, please.
Okay. Yeah, sure.
Okay, perfect. Is it possible to check how many people are looking with us or following us on YouTube? No.
YouTube, we take a look.
YouTube. Just one. We have two.
I'm here.
Come
I
back.
think
Yeah. I'm sorry. I have problem with internet. I'm on the road. This is why I can maybe a bit easy.
I think that we can start with the speech
Oh,
of Haru.
Yeah, please.
Before the internet will cut down.
Yeah, this is how I'm doing. It just really a couple of words I want to share with you. This regular event since May 2021 has been a good ground for constructive things and debate, discussion around the world of healthcare and topics. And the idea for us is really how we can share together something that we are living now and what we're seeing for the future. It's very, very important thing for us as for the university, but all the people working in this very large healthcare world. The chair was of this event in collaboration with my chair, Connected Innovation, my university, the hospital Champagne Sud, the EAHM. It's really good experience. I enjoy to try to understand how people working in different fields. I think this is what we appreciate. And the what I want to share also today, it's always meeting with people. I mean, it's a pleasure always to work with Philippe. When he has an idea for each minute, and they have to follow all this project he's asking us to do. It's a pleasure. And today we will be really with two speakers. I will maybe let Sharon introduce them, or maybe some couple of words, or I can do it up to you. But we will discuss about things presented, subject presented by Philippe and also by Mr. Luca Jalemon. Thank you. I enjoy. I wish you really good webinar and a good presentation. Thank you.
Thank you.
Thank you, Farouk. And good afternoon and good evening, and welcome everyone to our 5th joint webinar. And so I have the pleasure of moderating between our two speakers this evening. If you have, the running order will be, we will ask our first speaker, Philippe, to present on his topic, his experience from Calais. Philippe is currently the president of the EAHM and CEO of in English it would be South Champagne Hospital, but I'm sure
yes, that's right.
I'm sure there's a nicer way to say that. And Luca Gelmoni, who is the director of the Swiss Paraplegic Centre, will speak after Philippe. If you have questions for either of our two speakers, please put them into chat, and then I will ask the questions to the speakers when they finish their presentations. So on behalf of the EAHM, you're all very welcome, and I will ask Philippe to start with his presentation, please.
Thank you, Sharon. So, do you see my presentation? Yes.
Perfect.
I try to increase the size, but well, it's good.
Yeah, you have video projection en bas. En fait, le projeter c'est
Ah, c'est bon là. It's better like that.
Donc, c'est paramètres affichage et double en haut, paramètres affichage. En haut. Paramètres affichage à droite, paramètres affichage en haut, à gauche.
Je n'ai pas les paramètres affichage. Alors, en haut à gauche. Non, mais quand je fais projection, c'est ça.
Sinon, appuie sur F5, ça peut le faire.
Et ici, vous ne voyez pas mieux.
Là, c'est parfait, c'est très bien.
C'est bon là?
Okay.
It's good? It's good for everybody?
Yes.
Okay. So, you asked me to speak about the experience of Calais, but more precisely the experience about migrants, because Calais is a big spot of migrants in France. So a little word you speak about that, Sharon, but I am the president for 2 weeks, because after it will be Lucy Nugent that will become the new president of our association, but I am still for 50 days the president of European Association of Hospital Managers. I am actually the CEO of Hôpitaux Champagne Sud in French. It's a group of 8 hospitals in northeast, east of Paris, and you see Paris and Hôpitaux Champagne Sud, and I will speak about Calais, where I work as CEO during near 7 years, from February 2007 to May 2013. So my exposé will be in 3 points: the problem of migrants, the health system that we set up for migrants, and also about migrant-specific diseases. It's a view of Calais and this port. The problem at the beginning of the problem is that's the legal situation, because in 1991 there was an agreement between French and English government that says that French and United Kingdom outsource their border control to each other. So the control for people that want to go in England will be in France, and also the control of people who want to go in France from United Kingdom will be in United Kingdom. It was a little change with in Touquet by the Touquet's treaty, but in 2003, but it's near still the same thing. So the problem that it was not sure it was a very good idea for France, because there is not so much people that come that are in England and want to come in France, but there is a lot of people that want to come in England and have to pass by France to go in England. So there is, of course, people that come from past colony of United Kingdom, and when they arrive to go in UK, they are blocked in Calais by the policeman, and they live in a shanty town that was called, still called the jungle. And of course, our hospital in Calais have to provide care to these migrants. One idea about the population: when I was in Calais, it was around 1,200 people. In 2009, it changed very often, of course, but you can see some change in the, sometimes it's around 1,000, sometimes it's near 10,000. It changed, but there is always at least 1,000 people, often more, that needs care. Actually, it's around 2,000 people, and in Calais, and so around 600 near Dunkirk. Dunkirk is very close from Calais. The population of Calais, why they want to go to Calais? Because Calais is the main port in France to go in England, and so they went in Calais to try to go on a boat, and time to time the government tried to destroy the jungle, but every time the jungle is rebuilt, and only the place of the jungle could change. Sometimes it's in the east of the town, sometimes in the west, sometimes in the south. But the problem is that people want to go in the north, in England. So they are still here. At the beginning, before 2010, mostly the migrants are Afghans and Pakistanis, and it was only men. Then there was more and more English-speaking Africa people that came, and more women with them. Sometimes pregnant women, sometimes with young children, and also with the war in Syria, there is also Syrians now. About children, it's very difficult to have a clear idea. Actually, people said, some studies said around 300 children alone, but it's very hard to be sure about this number, because a lot of young adults try to tell us, I am not major, I am a children, I am less than 18, because you are much more right when you are less than 18 than if you are 18 or more. And it's very difficult to know if people is 15, 16, 17 or 18. So there is a doubt. So you can see some view of the jungle. This first is after a raid of the police that destroy it. but you see it could be a very, very big area with a lot of place to sleep. It's in the east of, you say it's in the east of the town. Here you see the road that go to the port, and also you see the interior of the jungle. And another part is rain a lot in Calais. It's a place where there is sun different times a day. So between 2 times of sun, there is a time of rain. So you can see the situation. And so there is a very big problem of migrants with a lot of people to have to need care, that need care. And what are the health system for them? The first thing is to understand that is near exactly the same than for French people, because hospital is a public service, and there is rule in France for public service, and the rule are the same for hospital. The main rule are adaptability. That means that the public service must change with technology and also with the needs of people. We can treat different people differently, but only because they have different needs. Not to say you don't have, not to say that some of them don't have the right of to go to the public service. We can adapt the public service, but to in the interest of the people. First, adaptability. 2, continuity. For hospital, of course, is 24 hours a day and 7 days a week. And equality, and that's very important for this one. Equality, it just means the same treatment for people in the same situation, and no difference because origins and religions. And neither the hospital staff nor the judge, the French judge, will accept the questioning of these 3 principles. That's in our constitution. So the treatment of migrants have to manage with 3 principles, and the only difference between migrants and French care are based on the principles of adaptability. Because equality, that means that migrants have to be treated exactly like French, and continuity, of course, that's our people. So in the organization, emergency, it was the same than for other patients. When there is an emergency problem with a migrant, he went, no, it's continue, he go to the emergency service of the hospital, and he's in the queue with the other patient. Hospitalization also is the same than other patients. They are in the bed, the same bed than other patients of the hospital. But consultation, there is a little difference because there is in French a system for very poor patients that the PASS device. PASS, it's in French mean permanence d'accès aux soins de santé. It's in English, it's permanence of access to healthcare. That's a special organization in all the French hospitals to give to poor people medical consultations, medication, and also to help them to access to social service and to get after social support. So, of course, migrants are poor and they are in the past, but it's a very unusual path because the population is very big. Usually, in French hospitals, there is no 1,000 of people that need of the pass, only some dozen or perhaps 100 people, but no more. And also, there is a special adaptation to migrants' needs, and I will speak about that. Because they are very numerous, we create a specific building. That's very unusual for in the past. Usually in the past, because they are not numerous, that's in the emergency of the hospital or in the maternity, because also it could be an emergency to go to the maternity. But because migrants are numerous, we have a specific building of consultation, and with a specific staff. Usually it was a part-time staff, people that were working also in the hospital during a part of the day, and who went in the building for migrants only half of the day or some hours in the week. There was a translator because, of course, these people don't speak French. A lot of them don't speak English or very, very bad. So we recruit a migrant. It was a Pachun, and we asked him to be the translator for the other migrant. And because he comes from Afghanistan, he knows a lot of dialect of Afghanistan. He spoke Tajik and so on, a different dialect. That's the same dialect with Pakistan, so it was very useful. And when you have a problem, he tried to find people that find the dialect and so on. So he helped us to have a sufficient translation for the care. And also there was specific schedules because it was only open in the afternoon because the migrants work in the night. They try to cross the barrier in the night because, of course, in the dark is more useful, and so they don't sleep during the night. They sleep in the morning, and after they have time to go to care in the afternoon in our specific consultation. And also we put in this building some adapted specialty, for example, dentist, because after when they stay a lot of months in the jungle, they could have a dentist problem, and so not. Well, it depends of it's more specific consultation we do in the past. That's for the organization. So exactly the same organization as the French, except adaptation for consultation. The point was the health issues. That was a little different than the other patients. First, of course, the great majority of migrants are young people in good health because they have to work and to take the road, but in very bad condition during days and days to do sometimes something like 3,000 kilometers or more, 6 or 7 or 10,000 kilometers to come to us. So they need to be in good health and to be young. But some of them come with diseases that have become unusual in Europe because there are not a lot of care in their country. They have illnesses related to living outside. Of course, I show you the situation of the jungle. It's not the best situation to live. And they have many, many traumatic accidents. And of course, they have illnesses related to the lack of hygiene. Alors, the comeback of all disease, it was more a threat than a reality. Of course, some of them come with the tuberculosis. It was the main old disease that arrived with them. And there was a great fear of seeing it reborn in the north of France. But there is in France a very, very good rate of vaccination against tuberculosis. BCG, that's the vaccination against tuberculosis, near all the young people get it. So the population stay in security, and we don't see a rebound of the disease. So the fear of all disease was fear, but not really a problem. Outside disease are more important because the weather in Calais is a little cold and very wet. The main temperature are between 5 and 70 Celsius degree during all the year, even in summer. It's very in summers also the weather is cold. It's rain every third day, and so it's very wet. And also there can be snow, and sometimes there is 10 under zero, so some 10 degree under zero. So the weather is cold, and of course, if you live outside, you can have some diseases because of that, and there was a lot of flu. That's not a big problem, but also some pneumonia, and sometimes very hard pneumonia, and that was a problem to care migrants. Fortunately, we have a service for that, but it would be hard. But fortunately, because they are young, it's easy to cure them, and not a lot of them stay a long time in our hospital, even if they try, because in hospital they have food, they are in good weather, they have with people who take care of them, clean clothes, and they don't they try to stay as long as possible in hospital. And of course, sometimes we have to say to them, hey, you are healthy, you have to go back. But it was they accepted that it was a point. Traumatic accidents was very frequent, because there was three big reasons. First, the fight between migrants, because there are clans per nation and or ethnic group. For example, between African and Afghan, or inside Afghan between Pashtun and Tajik, and so on. So there was time to time fight between different nation or ethnic group. Of course, there was some fight with policemen, and also there was attempts to scale the barriers that protects the border. And on top of the barriers, there is a razor blade barbed wire. So it was very difficult to go out up the bar, and a lot of them injury themselves on the barbed wire. About the fight, sometimes we have 10 or 20 migrants that arrive in emergency department after a fight, so it could be a big numbers. It was usually in the emergency department there was around 60, 80 people a day. So when you have 10 or between 10 and 20 people that arrive, is a big number of patients at the same time. And because of the people that try to go up the barrier, our orthopedic department became very good in hand operation, because a lot of them injure themselves on the barbed, injure their hand, and well, we have a lot of operation to do on this point. Yes, fate of the policemen. It's arrived. You see the border with the migrants that try to know when they can go inside, and you see it's a very serious border with things that can injure you a lot. And of course, when you try to cross the border like this man, you have a good chance to go after in the hospital with a big problem in your hand. Another point was the lack of hygiene, because it was very difficult for migrants to wash themselves. There was no running water in the jungle. It was in the middle of nowhere, so it was very difficult to have a shower. And also in the city, nobody wants to have public shower for migrants near their home. So time to time, a public shower was created and the city closed it because population say we don't want the migrant near us and so on. So part to part there is no not shower at all for migrants. So it's of course difficult, very difficult to watch in this condition, and sometimes there was pandemic because of that. And one times there appeared scabies epidemic among migrants, a very big scabies that perhaps half of the migrants are sick. And the fear was that the scabies would through the population. So with the authority called us, called the hospital to help and to manage a special operation against this pandemic. And we created a temporary unit, first to watch the migrant. Then at the same time, during we wash the migrant, we wash also and disinfect the clothes of the migrant and then dry the clothes. Also, during the same time, we offer a medical consultation against scabies, and of course, we gave all the medicine. And we success to defeat the epidemic in 3 months. And of course, French state paid our expenses for this operation. And it was interesting because perhaps people that working in an hospital know that, but for people that don't work in an hospital, it's a tent for nuclear, radiological, biological, and chemical emergency. It's a special tent you can give a shower and give with a SAS, and you can give some medical care. And in French, all the emergency department have a tent like that, and we have in Calais, and that's the only time we use the tent, because usually the tent is somewhere in the department, but we never have to use it. And this time we have to use our tent for this special operation against scabies. Last question, say who pay for that? You have to know in France there is different system to pay the care, but for strangers there is a system of daily fees, daily price. For example, if you are in medicine, you have a certain price. If you are in surgical department, another price. If you are in intensive care, another one, and so on. And we use the system for the migrants because they are strangers, but usually that's the strangers himself or their insurances, they pay the fees. And of course, for migrants, they have no money, no clear identity, no insurance. So at the beginning, it was the hospital that to pay, but it was too much expensive, and rapidly the French state pays the bill. But it was around, when I was in Calais, it was around 1 million euro a year. So for an hospital, the hospital was the budget of my hospital was around 170 million euros. So you see, it's 1 million euros. It was very, very important. The bad points about that every time the government destroys the jungle, we lose some money because migrants are outside, they don't come back to the hospital, and we lose money because we lose a part of our inpatient. But never mind, it was a very big business for our hospital. So in some words, it was our how we take care about our migrants. And I finish.
Thank you, Philippe. I know I spoke to you about this before, but myself and a group of hospital managers from Ireland used to travel over to the jungle to work in the first aid caravans, and so we brought quite a number of the migrants into your hospital. And I have to say that the care and attention they received there was exemplary. It was excellent, and the staff were kind and considerate to any migrants that we brought in. And I can certainly vouch for the amount of scabies that was in the camp, and the hand injuries as well. We used to see some horrendous hand injuries. So your team did a very good job of patching them all up and putting them back together. I have one question for you. Obviously, there are, as you've said, there would be illnesses and diseases that the migrants would have that you might not necessarily see, like trench foot and things like that, that you might not see on a normal day-to-day basis in ED, including sickle cell and other things that you've already mentioned. How did you ensure that your staff and your team were skilled in providing care for that patient group with illnesses that they might not have come across before?
Oh, you know, there is exactly the same problem with migrants and with other patients, and so the same protection and so on. And our staff don't ask more. And but about you say it's very yes, we were very good about that. That you know, a lot of migrants are better care. No, all the migrants. I think perhaps it was a little different from rich Syrian. If some of rich Syrians are in the jungle, but for Afghan, for Pakistan, for Africans, they are much better care than in their country. So it was very big, very particular, because a little schizophrenic, because on one side they live in very bad condition outside, without house and so on, and well, sometimes police was not very friendly with them, and they destroy all what they have and so on. But on the other side, we give them best care than they have never had in their life. So it was very strange. But I think about that, I don't know if French state could be very proud about what we do for migrants, but I think the French state and the French hospital can be very proud about the care to the migrants.
Yes,
that's the point.
Yeah, and I'd agree with that, and I'd also agree with your point that they were very reluctant to leave your hospital.
Yeah.
It was hard at times when we had to bring them back to the jungle. They didn't necessarily. They were disappointed to be discharged sometimes.
It's yes, it was very hard, because I remember a woman who was pregnant, and to say to this woman, yes, no, you have to go back to the jungle and you will come back for the birth. It was very hard, of course, and it was a bad question for our doctor and nurses, of course. But we need sometimes some migrants. I remember about one young migrant. We have a department in a very bad condition when I arrived in Calais. It was a rehabilitation department, but it was very old and with a room with 4 people only, or very old people. It was not very good department, and so and a lot of people try to go in another rehabilitation department than our before we rebuilt it. And a migrant a young migrant successfully stay 1 year site. He was very kind with the nurses. He helped them to care the other patient and so on. But at the time we said, you know, you have to go outside. And he was very, very sad because it was so wonderful for him.
Yes, yeah, exactly. Well, thank you, and thank you for obviously the wonderful care that was provided to the migrants there as well. So I'm going to move on to our second speaker. I'd like to introduce Luca Gelmoni, who is the CEO of the Swiss Paraplegic Centre, which is in Notwell in Switzerland, and is a nationally and internationally recognised private clinic specialising in spinal cord, back, respiratory care, and offers acute treatment and rehabilitation for life. Prior to that, Luca was the CEO of the regional hospital in Lugano, and his qualification, he is a computer science engineer. He also holds an MBA from Northwestern Kellogg School of Management in Chicago, and he has worked in many sectors and many countries, including industry, retail, and finance, in Switzerland and Germany, England, and Hong Kong. So we're looking forward to hearing your presentation, Luca, on cross-border commuters.
Thank you very much, Sharon. Thank you very much, Philip, for your presentation. And it's really a pleasure for me to speak to the European Association of Hospital Managers. I try to share my screen. So here you go. You see my screen? Perfect. Great. Can you hear me clearly?
Yes.
Yes, perfect. Thank you very much. So I choose this topic on human resource travel impacting the hospital, the case studies, so the situation in Switzerland. I choose a different approach of travel from the one that Philip presented. I analyze the situation from the point of view of the hospitals in terms of specialized healthcare professionals that travel in the different countries. So just to start, wait a second. Wait, here we go. So I just start to show you, everybody knows Switzerland, everybody knows where Switzerland is, but just to give you an idea of the points I want to touch. Switzerland is a small country in the center of Europe, and we have Germany, France, and Italy and Austria around our country. So being a small country, we have many areas where they are really close to the border, and you will see the consequences of this. I'm here. I'm in Lucerne. That's the center of Switzerland. I used to be here in Ticino, the southern part of Switzerland, and I will show you the differences between the two situations we have. So, some background information. Here you see three big hospitals in Switzerland: at Geneva, at Zurich, and that's the hospital where I'm working in Otril, close to Lucerne. So, some information. We have a high and constant increment of healthcare specialists that come from abroad. So we have many specialists in healthcare in Switzerland that are active as a cross-border workers, or they migrate, they come to Switzerland. You will see the figures. Is almost 40% of healthcare professionals in Switzerland are coming from abroad. They're not Swiss, they're not been educated in Switzerland, and they really come to Switzerland. Switzerland is an attractive country in terms of wages, quality of the infrastructure, and the working conditions. I think we are quite attractive compared to the countries around us, in particular compared to Italy, compared to Germany. We give really a good working conditions. And one important thing, and we will see that there are big difference among the different regions of the country. In the regions close to the border, you have more foreign workers, and in the area in the center you have less. That's fairly logical. And I think we're not the only one, but post-COVID we really struggle to keep up the level and the responsiveness of our healthcare system. We have a very performing healthcare system, or let's say a very good healthcare system. I'm not sure if it's well performing. I'm sure that it's very expensive. The healthcare system in Switzerland, we pay around 12% or 30% of our GDP for healthcare in Switzerland. In total, it's a quite a high number and a quite high figure. I think only US are more expensive than Switzerland in terms of investment in the healthcare. But after COVID, we have many healthcare professionals, in particular nurses, that left the job and they quit the hospitals for other jobs. So Switzerland is attractive for foreign workers. The income level in Switzerland is higher compared to the neighbor countries. Let's say if you look at here is the list of all the European countries and then also other countries in terms of income. If you have Switzerland, just Luxembourg in Europe that is better than Switzerland. This is Italy, it's another country very close to Switzerland, France and Germany. So you can see really the difference that we have in the income level from here to Switzerland. For a nurse, I know it from Italy. If they work in Switzerland, they will earn double as much as they earn in Italy. So it's really 100% more the income they will have in Switzerland for the same work, for the same job, on, I would say, a better condition than being in Italy. And this makes a huge difference, and this makes Switzerland attractive. Switzerland, we have, as you know, 3 regions, 3 languages in Switzerland. You have the German part of Switzerland with 67% of the population that speaks German. You have 24% speaking French, a small 8.4% speaking Italian, and an even smaller 0.6% Rätoromanisch. You cannot forget this part, but it's very small. And all the Rätoromanisch, they speak German. So let's say we have 3 languages in Switzerland and 3 cultural regions. They are different, and they are let's say also quite divided. You have really here there is a cut, and you don't really have a lot of exchanges between French and German part of Switzerland. But we keep together, but we have 3 different countries in one country. So some figures on the cross-border workers. We have a population of 8.8 million in Switzerland around now, and we have 350,000 cross-border workers. It means you have 350,000 workers that are coming in every day to work in Switzerland, and they leave in the evening. And you see also how they are divided in the different parts of Switzerland. 71,000, that means 23% of all the cross-border workers, they come from Italy. And you can remember we have just 8% of the population in Switzerland that speaks Italian. Same thing, 55% are resident in France, and they're coming from France to Switzerland. And the Swiss part, the French-speaking part of Switzerland is just 25% of the population. So you see here, you already see this balance is not balanced, it's not even what you have. And the German part is small. You just have 18% for 67% of the population. And on average, 5% of the workers in the healthcare sector in Switzerland, they are cross-border workers on average on all over the country. So that's just keep in mind this figure. French-speaking part, a very high number. Italian-speaking part, also a high number, and 5% on average. Here you see Switzerland. So Switzerland with the different number of cross-border workers in the different regions. You see here in the southern part, in the Italian part of Switzerland, you have more than 50% of all the total workers are cross-border workers. They come from Italy and they work in this area. As far as you go from the border, the less cross-border workers you have. That's quite normal. It's quite logical. but he has a big impact on the healthcare and the hospital. Here in Geneva, you also see many foreign cross-border workers. Here is a special situation with the watch industry. They're all coming from France to work in Switzerland in the watch industry. Here we have an important shortage on healthcare specialists in Switzerland, and in particular on nurses. We cannot run all the beds we have, all the physical beds we have in our hospitals, in particular in the hospital in the center part of Switzerland, because we don't have nurses. And you have a high percentage of nurses coming from abroad. As you can see, 36% on average of the nurses in Switzerland are coming from abroad, cross-border workers or nurses that move to Switzerland. And the figures are very different. You see here in Geneva, in this area, 70% of the nurses, they are coming from abroad, so outside Switzerland. And if you go to Nidwalden is one of the cantons here in this area, in the center of Switzerland, you go down to 11%. It's really a huge difference, and it's also a huge difference on the way and how you can recruit nurses. In Geneva, it's not a problem to recruit nurses. You have 40% of the nurses, they are cross-border nurses. In Ticino, we have 25% of the nurses, they are cross-border nurses. It's not a problem to recruit them, but in the central area, it's very difficult. So there is a big difference among the area, and we don't have the possibility to keep up the service we used to, because we don't have enough nurses. I can show you my personal experience. As I told you, I moved from Lugano, from the southern part of Switzerland, here 1 year ago to Nottwil, to this specialized center in the center, and really in the center of Switzerland, close to Lucerne. And I changed from a situation here in Lugano where we try to keep the number of foreign workers as small as possible in order to keep up the Swiss culture, Swiss working culture in our hospital, to a situation where here I'm not able to recruit nurses to run all the beds. I have to close the beds, in particular in the ICU. I have 16 beds in my ICU, and I can run just 10 beds at the moment because I don't have the nurses. And we are really struggling. We are trying to do everything in order to get nurses and to be able to keep up the service in our hospitals. So, which are the measures that we try to put in place in order to keep up the attractivity and attractiveness and to prevent the problem in the future? In the border area, we still don't have a problem, or we really have a problem in the future. So we have a quite high increase of the wages, more than on all inflation level. We have in cities like Zurich, where the wages of the nurses has been increased by almost 10%. We will increase the wages next year by 3%. So the cost of the healthcare increase is really highly increasing in Switzerland. We have a reduction of working time. So the nurses are paid 100%, but they work just 80%. So they have an increase of almost 20% of their income, just to keep them in the job, to attract them. And we have paid changing time. We increase the number of nurses per bed in order to reduce the workload on the nurses. We invest in continuous education, and in Switzerland we vote for everything. We vote every 4th month. There are initiatives, and last year, 1 year ago, we had a vote for a so-called nurse initiative, where the population decided to give better working conditions for the nurses, better education, better less working hours, and more to pay them more. The problem is really who is going to pay for this. We don't know yet who is going to pay for this. We voted, the population said, yes, we want to support the nurses, but we don't know yet how to do this. It's in the implementation, this initiative. So as a conclusion, I go to my conclusion. Human resource coming from abroad is a very important element in Switzerland, and is well utilized. So we try to do our best in order to be able to run our hospitals. Without foreign workers in Geneva, we will not be able to have a university hospital. In the southern part of Switzerland, with 25% of the workers, of the nurses being cross-border, and in total of 45% of the workers coming from abroad, we will not be able to keep up. And we profit really from the situation. It's a win-win situation, basically, because it's a win-win situation for the healthcare system, for the hospital. It's a win situation for the workers, for the nurses, for the medical doctors. They come to Switzerland, earning more, having better, I suppose, better working condition, and being in a good organized system with good infrastructure. On the other side, we just take the human resources from France, from Italy, and from Germany. So we take them. Basically, it's a run among poors, if you want, because nobody has enough human resources, but we have the opportunity in Switzerland to keep them on our side. The future is challenging because, as I said, it's a global shortage of healthcare professionals. And what is necessary, what we have to do is to implement a clear strategy of job enlargement for our healthcare professionals. We provide better conditions. We provide the opportunity to participate to research projects, to participate to specialized education paid by the institution. That's really what we do in order really to keep the workers and the healthcare profession. And then it's really important to acquire partnership among the regions so that we can really move the healthcare profession from one region to the other, and to also to balance the number of hospitals. I'm sure that we have too many hospitals in Switzerland. We can afford it at the moment. I'm sure we will be able to afford it from a financial point of view also in the future, but we will not be able in the future to afford the number of hospitals we have today because of the shortage of healthcare professionals. This is the biggest challenge we face in Switzerland, and we profit from the situation. And I'm sure this is a strategy that can be implemented by Switzerland, but can also be implemented by other countries in order to keep up and to be able to run the healthcare system we have at the moment with the quality we have at the moment. Thank you very much for your attention. As you see, it's a nice place to be in Switzerland. It's not really in the center of cities where I am here in our center for spinal cord injured patients. It's an acute and rehabilitation center we have here. I'm open for your questions. Thank you very much for your attention.
Thank you, Luca. I have a question for you. The question is, how do you manage increasing the number of nurses per patient to reduce the workload, knowing that the mentioned difficulties in recruiting enough nurses to run all the available beds?
That's a good question. It's really difficult, but it's just a race among the hospitals. The one that offers the better working conditions is the one that get the nurses, and the one that is not able to offer this good working condition, they will have difficulty. So we just get the nurses, we get the medical doctors from one institution to the other. The stronger will win. I'm sure the best will win in the future and will be the one that will make the race. I'm sure we will not be able to run all the hospitals we run today in 10 years' time. We have to concentrate, and we need to be more efficient in terms of hospitals and concentrate on the big hospitals.
Okay, thank you. And do you think, I know it's that the pay and conditions are better in Switzerland, and obviously it's a method that you're using to entice staff from surrounding countries. But do you think we get to a point where that in the future only those countries who can afford to pay nurses at those types of salaries will be able to offer a good healthcare service?
Probably yes. Probably yes. That's a big challenge. We have to invest in Switzerland. We invest a lot in education. We invest a lot in bringing the young people to go in our industry. But it's not easy. Every time you open a newspaper, you listen to the media, you hear how it's difficult to be a nurse, how it's difficult to work in the healthcare, and it's very difficult to do this. But we invest and we try to be as attractive as we can. Basically, the good thing is that being in healthcare, it's sure that you will have an industry, you will have a job in 20 years also. And in other industries, you're not sure if you will have it. For the healthcare, and you cannot outsource, you cannot bring the healthcare abroad to low wages countries. You have to do it in your country.
Mm-hmm. We have a comment in there from Paul, who spoke at our last webinar, and I'd agree with him on this. As in, we can continue to look at the lack of experts as a competitive task, where one country competes with another, and basically the country who can give the best conditions and pay wins. Or we could look at this problem from a more public health perspective and try to manage the problem together, and potentially look at alternative methods of delivering healthcare as well. What are your thoughts on that?
Yeah, that's what I wrote on my last slide. The conclusion. It's important that this. Wait a second. It's not working. That this implementation requires partnership among the regions and probably among the countries and the healthcare institution. We need to work together. It doesn't make sense to continue with this race for the next 20 years because then the cost will explode and we will not have the possibility to keep up. I fully agree with Paul.
Yeah, very good.
I have a question, Sharon, if possible.
Yes.
Yeah, thanks a lot for the both presentation. I appreciate a lot some specific topic. Maybe for for Luca, Mr. Delamoni, I have a question about what do you think that how we can improve the skills needed for this kind of job like nurse, according to the digitalization, the new technology, it could make it easier, make it different. How we say, practice in different way with a different way. Is it something that could be explored, maybe Richard?
I'm sure what we can do, we can really enlarge the job, enlarge the type of job the nurses do and perform, and they can take over some tasks from medical doctors. In Switzerland, the nurses, they cannot do a lot. They're really nurse. And I know from the UK, I know from Scandinavian countries where nurses can perform ultrasound test and stuff like this. In Switzerland, it's not possible. I'm sure that you can make the job more attractive with digitalization, with education, and giving them more responsibility. That's because now we have a big problem with nurses. We don't have a big problem with medical doctors, but that's the next step. In the next 10 years, we will have the same problem with medical doctors.
Perfect. Thank you.
Thank you, Frog. I think that's all our questions. So I'm going to say thank you to Luca and Philippe. Thank you very much for two very interesting presentations and for taking the time to present those to us this evening. I'd like to thank is it Chaire Connected Innovation and the Institut Santé de Technologie de Troyes, UTT, and of course the EAHM for hosting this webinar this evening. Thank you, everyone. That was, as Claude says, very informative and very interesting. So we look forward to seeing you all again soon.
Bye.
Thank you very much.
Bye.
Bye-bye.
Thank you, Sharon. Thank you all.
Bye.
See you,
Thank you.
Nadine.
Bye.